Dental therapy can be a great opportunity for dental assistants who want to do more. Dental therapy is a policy solution that didn't come out of a think tank or the federal government or a university. It came out of Alaska tribal communities.
This is something that dental assistants maybe can even evolve into at some point down the road.
Dental therapy is a pretty well-paying field. It can be, not just a livable wage, but like a family supporting wage.
I've been asked so often about dental therapists and what that means for dental assistants. We brought on an expert today to answer those questions for you. Are you tired of stressing over dental supplies? Have you been placed in charge of procurement, inventory, price shopping, or otherwise being that get me this man or woman? What if there was a fully automated software so you never have to order supplies again? Dental Supply Guy can automate the entire process for you. Never again will you have to worry about whether you ought to order based on the inventory or upcoming schedule. Dental Supply Guy will take this weight off your shoulders and allow you to do more of what drew you to dentistry and less of what draws you away from dentistry. Simply book into the calendar at dentalsupplyguy.com and talk to one of Dental Supply Guy's sales reps. If you book a demo before December 15th, you will get a $50 gift card just for seeing how it got started. Dental Supply Guy is helping dental assistants do less busy work and more dentistry, so visit them at dentalsupplyguy.com. I've always had just one goal for Dental Assistant Nation, and that was to reach as many dental assistants around the world as I possibly could. So thank you for being a part of the community, and I want to make sure that you have hit the subscribe button so that you can not only help us spread the message and we can grow our reach, but also to make sure that you are getting the latest episodes delivered right to you the moment that we drop them. We are all about dental assistant education and empowerment here at Dental Assistant Nation, and we want to make sure that we are reaching as many dental assistants as possible. So thank you in advance, not only for being a part of this community, but for helping us spread the word. Hey everybody, welcome back into another edition of the Dental Assistant Nation podcast. My name is Kevin Henry, founder of Dental Assistant Nation. So glad you've joined us. It's a hot topic. It's one that a lot of dental assistants have asked me about. And so I'm bringing on an expert as we talk about dental therapists, what you need to know, and their impact on dental assisting. And with that, I'm going to bring on Laura Brannon, who's the Senior Project Manager for Dental Therapy Project for Community Catalyst. Hey Laura, how are you?
Good, Kevin. So glad to be here today.
I am glad to have you on. I'm thankful that you took a few minutes out of your busy schedule to join us. And before we dive into the topic, I'd love for our audience just to know a little bit more about you.
Sure. So I am going to confess that I have no oral health background, but I've been working on oral health policy for 10 years. I've been in my current role at Community Catalyst for 7, and previously I worked on the dental project at the Pew Charitable Trust. And I was a new grad, kind of with a poli-sci degree, wanting to work in public policy. And when I got the job at Pew, I thought, I'm going to do this for a second, and then I'm going to transition to another field. This is not something I'm interested in. And it's been 10 years. And I think it's because when you start working in this issue, you realize actually it is so important, and access to oral health care and dental disease is affecting so many people's lives. So I got to say, I've been doing this for 10 years. I have absolutely no clinical background, but I just get to work with so many incredible people, and I'm really passionate on the topic.
The passion is the key. Absolutely. And I'm really, really glad you came into this. And I'm glad we're going to talk about this today because I know that 2025 National Dental Therapy Conference is going to be happening December 8th through the 10th, so not far away.
It is.
And dental assistants are one of the audiences that you're reaching out to. So I'm curious, just from a 30,000 foot view, tell me, dental assistants and dental therapists, how do you see that relationship?
So, dental therapists are another member of the oral health care team, just like dental assistants, dental hygienists, dentists, obviously. So dental therapists are going to be able to do a bit more than what an assistant can do. They do have to attend accredited education programs, and dental therapy can be an opportunity for dental assistants who want to do more. Education programs are able to offer advanced standing if they want to dental assistants, or even if, a dental assistant isn't able to do that, maybe they're a chair-side trained assistant, so they haven't gone to a formal education education program before. I know so many people who first enter dental assisting want to do more. They're like, you know what? I'm really liking this, but they aren't sure what else there is. And dental therapy can be a great opportunity for dental assistants who want to do more, and they work right alongside dental assistants. And, just like for dentists working, dental therapists need dental assistants right next to them. I feel like dental assistants are frequently the glue that makes the dental team work together.
Won't argue with you there, yeah, on any stretch. I know that dental therapists are not all over the country right now. There are, I believe, 14 states with dental therapists.
That's right. We're at 14 states. They've been working for 20 years in the US, although have been working globally for over a century and are authorized in about 50 other countries. But we're at 14 states in the US, but that number is pretty rapidly growing.
What's the main reason that people are hesitant about dental therapists, would you say? And how are you all trying to overcome that?
Sure. I think a lot of it comes from the fact that people know what exists. People are comfortable with the system as it is. And so I can tell you, we know if you look back, I don't know if it was 50, 75 years ago, whenever it was that dental hygienists first got introduced, there was a ton of resistance. And a lot of the arguments that we are hearing about dental therapy are really similar arguments to what we heard back then. And I think it's the same thing for especially when dental assistants and expanded function dental assistants started coming up. Concerns about, well, is this safe? What about the quality of care? Are we still going to need dentists? Which I do laugh a little bit about because I think that is frequently kind of the pushback we get is a lot about, is this supplanting dentists? And absolutely not. Dental therapists are working under the supervision of a dentist. They're being trained by dentists. They're being employed by dentists. No one's getting supplanted. And also, I don't think I need to tell you this, but in a country where less than half of the population is getting dental care every year, and it's inaccessible and unaffordable for so many people, we need every member of the oral health care team, and we need them all working together and at the top of their scope. And so I think, this is a really great opportunity for dentists and dental assistants and hygienists, of course, as well.
Yeah, the entire team. And one thing that
Yes.
I've heard about dental therapists, and I want your opinion on this, tell me if I'm right or not, is that this is something they're working in a lot of the underserved areas, those dental deserts, shall we say, where a lot of
Yes.
people need that care.
Absolutely. And so this was the original point. This was the point of dental therapy in the US. Dental therapy is a policy solution that didn't come out of a think tank or the federal government or a university. It came out of Alaska tribal communities, which were probably the communities 20 some years ago that had some of the worst access to dental care in the US. And the tribal leaders there were really innovative and really courageous. And they said, we are going to look sort of outside the box. We're going to look actually outside the nation and figure out what are other strategies. And they landed on dental therapy and realized this worked really well. And so dental therapy now very successful in Alaska tribal communities, but access to care is not just a problem in Alaska. And it's not just a problem in rural communities too. We know urban communities have lots of access issues. It's a problem for so many people. And so a lot of state laws governing dental therapists do say that dental therapists have to work primarily in a safety net setting, or they might have to take a certain percentage of Medicaid patients. Not all states have a requirement, but the real point of dental therapy, I think in every state where you see that it has been authorized, it has been an attempt to do something about increasing access to care for people with the least access. And we particularly see dental therapists moving a lot into those rural sort of DIPSAs, the dental professional shortage areas, and working a ton in nonprofit clinics and community health centers.
We hear so much about the staffing shortage right now when it comes to
Yeah.
hygienists, when it comes to
Yeah.
assistants, even the front office. Are we having that issue with dental therapists?
I would say that the dental therapy programs cannot turn them out fast enough. So I think it's a slightly different issue because I think for dental assisting, dental hygiene, these are really well-established programs or well-established professions, I should say, that have a lot of programs that can graduate folks, although sometimes you do need more. But also sometimes a lot of that, I think, is about people joining the workforce and leaving for a number of reasons. We know a tremendous number of dental assistants and dental hygienists have left the workforce, particularly in the last 5 years. With dental therapists, we don't have enough, but it is more an issue. The limiting factor is more about education programs so far. Because it's a newer profession and we're still really working on implementation, we need more education programs in the US. And so there are a number of schools working on it, but we don't have enough yet. So there's a limiting factor, but it's just a slightly different one right now.
I cannot wait to be a part of the Rocky Mountain Dental Convention in 2026. We're going to be talking about the real state of dental assisting in 2026 in Denver on January 22nd and January 23rd. So I want you to be a part of this because dental assistants, we're going to bring you together in the Mile High City at the Rocky Mountain Dental Convention. And we're going to be talking about the things that are going well in the profession, as well as the things that we can improve. It's going to be a great time of learning. I want to see you at the Rocky Mountain Dental Convention in Denver, January 22nd and January 23rd for real talk about the state of dental assisting in 2026. Join me and let's be real with each other.
I know one of the things that you mentioned earlier, and I want to touch on it again, is that this is something that dental assistants maybe can even evolve into at some point down the road, just like there's a
Yes.
chance for them to become dental hygienists, dental therapists. What does that
Mhm.
look like if I'm a dental assistant and I say, I might be interested in this?
Sure. So there are different programs in different states. And I should say dental therapy laws vary a little bit by state. Most states don't have a specific degree requirement. There are a couple of states that have a specific degree requirement to be a dental therapist. And some states also say you also have to have a dental hygiene degree. So first, you need to check the jurisdiction you're in and figure out what the local requirements are. But I would say, in general, what you're going to have to do is you want to find an education program, which, again, I mentioned we don't have quite enough of them yet, but they are opening. We've got new ones opening every year. But for instance, I can use Washington State as an example. So in
Sure.
Washington State, if you are a dental assistant, you want to be a dental therapist. So there is an education at a public community college, or there's an education program at a public community college in Washington State. I know they have a number of students who are dental assistants. I don't think they can formally give advanced standings to students, but what they can do is if you've already taken classes in college, like gen eds or things, you can sometimes get a little bit of time off. That program, I believe, is about 30 months. And so it's not that long, but it's pretty intense. But what you do is you graduate with that. That program I know is an associate's degree. Some programs in the US are associate, some are bachelor's, some are master's. You can get a varying levels of degrees, although dental therapists between states pretty much all have the same scope. So it's not like a higher degree equals a bigger scope. It's more about sometimes what other credits you've done first. But, if you're in a state like Washington, you can go to that education program. Maybe you're able to get a little bit of time off for prior credits depending on how much schooling you have done. Sometimes it might be you have to do the whole 30 months, but you graduate, you take your board exams, and then you can go ahead into the profession. And, dental therapy is a pretty well-paying field.
Right.
Generally, what we say is how much a dental therapist will make in the setting. It's about a third to one half of what a dentist would make in that setting. So particularly in a place like a community health center. So it can be, not just a livable wage, but like a family supporting wage. And I do know that the fact that dental assistants are frequently not paid enough for what they do. That is a big reason I know that a lot of dental assistants do have a lot of turnover. I can say in a lot of states I work in, people tell me, being a dental assistant is a hard job and I can make more as a cashier at a grocery store. And if you're not being paid enough for that, I have to imagine a lot of folks maybe aren't going to stay in that profession for a long time. So dental therapy can also be a way not only of doing more for yourself, for your community, but also of really growing your wages.
It's funny you mention that because that's why we lose so many dental assistants to dental hygiene and other places is that
Mhm.
it is the pay. It's not that they don't love what they do, but they want to
Mhm.
transition to something like that as well.
Yeah.
Could you just give me a 30,000-foot view? And I know we touched on this very briefly at the
Mhm.
start, but a dental therapist, what
Mhm.
exactly do they do? And does it vary by
Sure.
state like it does for dental assistants as well?
Yeah, so there is some variation by state, but I would say there's less variation by state than there is for dental assistants. So, dental therapy has CODA standards. So, Commission on Dental Accreditation is that national entity that sets standards for training dentists, dental hygienists. There are standards for dental assistants as well for folks who do attend those CODA accredited programs and dental therapists. And so, when CODA sets standards, they set a minimum. So, if you go to an education program that's CODA accredited in the US, you have to learn that floor of procedures. States are allowed to add additional procedures, though. So there is, I would say, probably 95% overlap in scope in between states, but sometimes there's a little bit of variation. Particularly, dental therapists are able to do pretty much all the preventive procedures that you might expect. They don't have the full scope of hygienists. They're not able to do generally root planing or some of those more advanced periodontal procedures. A bulk of what they're doing are exams and restorations. They're preparing and placing fillings, and it's that preparation of fillings that frequently really separates them from what other providers can do. We know that, like, getting a filling in your cavity is frequently the most common treatment a patient needs, right? And right now, only a dentist can do that. And so having a dental therapist be able to do these sort of more basic treatments, that's freeing up the dentist to do the more advanced stuff, to do your crowns and your root canals and all those pieces. They're doing also things like stainless steel crowns, on primary teeth. They can extract primary teeth. They can do limited extractions on permanent teeth. And sometimes some of those things like extractions of permanent teeth, a little variation between states. Some say it has to be a +3, +4 mobility. Others don't specifically include that in the language. So there's little variations, but for the most part, there's a lot of consistency.
And last question for you. I'm just going to ask you to look into the crystal
Yeah.
ball a little bit. What does
Yeah.
2026 hold for dental therapists?
So I think 2026 is going to be a really good year. So every year we're seeing more and more states picking up legislation to look at authorizing dental therapists. And we see, that we're up to 14 states and that number is growing every year. And we know there are a lot of states that are looking at authorizing legislation again next year. Last year, Florida made it really, really close. They made it all the way through the House and to the Senate floor. I am really fingers crossed, but I think Florida might do it next year, which would be really huge to have another state coming on board. We're looking at probably a couple extra dental therapy education programs opening in this country, which is going to be awesome. More opportunities to folks be getting educated. And generally, I just think more and more people are learning about this. You alluded to the fact that it has been a little controversial. I can say
Mhm.
I've been working on this for 10 years, and it is so much less controversial now than it was 10 years ago. I think people are really learning about it. It's being normalized. And dental therapists have been working here for over 20 years, and the sky hasn't fallen. And instead, more people are getting care, patients are happy, patients are healthier, and I think people are really realizing, actually, this is a really good thing. It's a good thing for the patients. It's a good thing for the dentist. It's a good thing for dental assistants, too. More opportunities, more teammates, more opportunities to collaborate.
The Chicago Midwinter Meeting. It's one of the biggest meetings in the dental industry every year, and this year is going to be extra special because I'm going to be talking to dental assistants at the meeting, and I can't wait to be a part of it. So dental assistants and dental team members, join me Friday, February 20th, as we talk about harnessing the powers and personalities in the dental practice. Why can't we all just get along? We're going to talk about that. And then Saturday, February 21st, it's going to be extra special because dental assistants, this one's just for you as we talk about battling and beating the demons of dental assisting. So join me at the 2026 Chicago Midwinter Meeting. I can't wait to see you in the Windy City.
Well, good things are great to hear on this podcast. So I appreciate that. And Laura, if there's somewhere that a dental assistant wants to learn more about Community Catalyst or maybe the dental therapist in general, what would you suggest?
So if you want to learn about Community Catalyst, I would say check out our website, communitycatalyst.org. We've got a lot of information. We work on oral health and we work on a lot of other kinds of health policy as well. So if you're interested in learning about that, and there's a lot of other policies that are important about governing access to dental care. So check out some of the stuff we're doing there. We're doing some really interesting stuff. And dental therapy, we co-chair the National Partnership for Dental Therapy. We have dentaltherapy.org. We've got a lot of really good resources out there. And also, I think, if you Google me, you're going to find my email address, not that hard. Please drop me a note. I do this all day long and I love talking to folks. So anyone who wants to learn, I'm always happy to chat.
That's awesome. Well, we're going to make sure to put those websites in the show notes, real easy for you to find, as well as maybe how to get a hold of Laura as well. You can't ever tell. So anyway, Laura, I appreciate the time today ahead of the conference. Thank you so much for taking a few minutes.
Absolutely. Thank you for having me.
Absolutely. And thanks to all of you who've listened to this episode of the Dental Assistant Nation podcast. I've been asked so often about dental therapists and what that means for dental assistants. We brought on an expert today to answer those questions for you. If there's ever something you want us to tackle on the website, hey, hit us up at Dental Assistant Nation. We're happy to do that. Until next time, Kevin Henry, the founder of DA Nation, signing off, and as always, wishing you nothing but success ahead.